like, general public, you might be a carrier. The carrier look quite normal. I'm a carrier. My husband is a carrier. All our metabolic activities are normal. So we only presented ourselves as a carrier when I gave birth to a defective child. So carriers usually don't have any symptoms. So they have to get these simple blood tests done before marriage. That is what whenever we are conducting a blood donation camp or anything, we are distributing pamphlets on thalassemia in a very detailed manner in all the 3-4 languages. So usually in AP we have Telugu, Hindi, English, Urdu and all. So we distribute those pamphlets to them. We explain them, and then we are trying to motivate them in this way, so that the incidence of thalassemia, major incidents are we are not being overburdened by these children.
Absolutely.
So already we have 1300 children with us.
And to see them suffering is much more painful.
Much more painful.
And another thing I want to add, like, we are talking, the many learned people, they will go for this test. And still many of them, it is not our headache. We don't have any other problem. So they don't go. Even if you tell them you go for the testing, many of them, they don't go for this test. Unless a child is born in their family and all. Some movie type of thing or some documentary film, if from the movie cinema, going like we say HIV, AIDS, some 1 minute thing and all comes before. Because one time if you say, it doesn't register in their mind. Repeatedly when they go for movies and all, if they see this thing, okay, what is this HbA2, they may ask from their doctor and all, and can go for this test and all. 1 minute documentary film, if we can make and show in the cinema hall and all, I think lot of awareness can be done. Or some movie is made like Tare Zameen Pe and which Amir Khan is about dyslexia and all.
True.
So many of them have understood. It has gone to grassroots level also. If we can make some movie like that pertaining to this disorder, which is preventable, so I think it will create lot of awareness in the community.
Absolutely.
If government also come forward, because this is 8% population is not a small percentage.
Absolutely.
5 to 8% is not a small population. So if government also makes it, it's a mandatory. See, like we have given an application to government also. Before you go for any marriage registrations, please show this certificate. Or if joining into the colleges, make simple mandatory things, will make lot of difference.
Absolutely.
If government will come forward and do these things, the wonderful things will happen. Like Cyprus has done today. There's a zero thalassemia.
Iran they
there.
are doing.
But
Iran, what they
here
are
also, at least we can also do it in AP. That will be a wonderful.
It should be a joint collaboration of all the people,
corporates,
government, whoever is involved in it.
In PCH.
Absolutely, because what you said is 5 to 8% in this highly populated country is a huge number.
Huge number, yeah.
So there must be awareness, there must be a total people or society who should be working towards it. So there's a lot which goes in it. So the right message in a right way coming from people really helps to get this disease eradicated totally. So any message that you want to convey to our associates before we conclude this session?
Like from our society, care and control of the children who are already registered, that has to be done. And also the prevention, creating awareness. Now so many social networking sites are there. I am not very much aware or comfortable, but many young people are there through Facebook, through Twitters and all. They try to spread this message. It will be really good doing HbA2 test before marriage and detect your carrier status and stop the birth of thalassemia major.
Absolutely.
Because it is not the child we can take care, but the emotional trauma, the financial drainage, that is the big issue. Like, it is a very big issue. It can't be, we can't just say the government to do all those things.
Absolutely.
And all. Government should also have the revenue to do the things. So if all of us come together, we can prevent this disorder, how the Cyprus and the Sardinia has done it.
was very nice talking to you, Dr. Suman, and in fact, a lot of things about the disease, prevention, symptoms, we could let people know about it. And very nice to talk to you, Ratna, because we could actually see what a parent goes through when the child is suffering from the disease, and what exactly the feeling which is hidden in the entire trauma. If you have any questions or you have anything to talk about thalassemia or want to have a face-to-face conversation with Dr. Suman or Mrs. Rathnavali, you can reach us on planet_Mahendra Satyam, and we will share the numbers of the duo with you. Also, you can reach their website, which is www.tscs.in, and you can actually get more awareness on this disease. With this note, I thank you, both of you, to come over here and do a wonderful session for us, and thank you once again. That's all from the studio.